I loved.
I remember
loved
the
the
people.
burn unit.
Just the people
The
on the
people,
burn unit,
yeah.
yeah.
Yes,
Yeah.
that's exactly it, the
Yeah.
people.
And the team there was they were always very, like, they knew their stuff. They're very knowledgeable. I always felt like we were getting the best of the best in Calgary.
I think everybody says that about their team, and they have to say that, but we really have the best team.
Patients and families feel welcomed when they arrive, which is certainly our goal, for them to feel comfortable.
We have a small family space, so whether it be an update from the doctors or time with our burn psychologist or our social worker, or even sometimes the wound care can take 2 or 3 hours. And there's not a lot of spaces around this hospital to sit and be comfortable.
2003, they renovated the burn unit, so we have lots of room for our burn patients. Everybody gets a private room. It's fully equipped with really nice things. Our rooms are really nice, and patients, they need it. They're in bed for a long time. They're in their rooms all the time, so they need some comfort.
Our patients transition to outpatient care just down the hallway. And where I think that's really important is they get the same care providers. They also get the opportunity to go to the outpatient gym while they're inpatient, so they might connect with other outpatients. And then seeing some of those familiar faces from their outpatient or inpatient experience and connecting with other survivors.
My name is Dr. Vince Gabriel. I'm the medical director here at the Calgary Firefighters Burn Treatment Center. I also manage clinical research, and I collaborate with Dr. Bernaski on basic science things. Although we have our specialized kind of sub-teams of very much core clinicians, very much core scientists, we do try to integrate the two as much as possible here.
My name is Lindsay Burnett, and I am the nurse practitioner for the burn program here at the Foothills Medical Center. So I actually worked in the lab too, so I went down and skin grafted mice and worked with the animals and got to do some of the bench science and doing some of that research to really impact patient outcomes, because that's really why we're all here, is to make the lives of these burn patients and survivors better.
All of the clinical staff not only provides fantastic burn care to patients, but they're also really keen to be involved in the research endeavor, which is not something that you find in other vicinities. And we have students here that are really keen, they're really driven to translate the things that we find in the laboratory into clinical practice.
The research has come so far, even just in the 13 years since Mom's accident. So funding research is crucial to helping burn survivors.
Over the calendar year 2023, almost doubled our inpatient admissions. And of those patients, a greater proportion of them, about 3 times as many were severely sick or had to stop in the ICU before they were transferred to the burn. So patient volume is higher and severity of injury is more significant.
Our burn volume has been exploding. We saw an increase last year of almost 80%. We were renovated last in 2003, and we need to expand. So we're getting outdated. We need more room.
We are one example, but there's going to be a new burn tomorrow. There's going to be a new burn next week, and those families are going to continue to need the support year after year after year. All of the healthcare professionals that we've encountered, they go above and beyond. They always go above and beyond.